I'd like to thank Senator Flake and Tillist and Senator Ernst. She's providing what she'd be here, and I'd also like to thank Senators Ayotte, Graham, Cornyn, and Cruz for co-sponsoring this legislation. The legislation we are introducing is an all-of-the-above approach to improving access to care at the VA. We developed this legislation after speaking directly to veterans about the problems they experience every single day. Probably the greatest boon to the United States economy took place following World War II, when we gave the legislation concerning the GI Bill, which gave every veteran the opportunity to exercise their choice and to pick the educational institution that they wanted. That resulted in a tremendous boon to our economy, and of course was so important to our veterans. This is all about choice. This is all about whether a veteran should be forced to go to a single place where they would receive medical care, or whether they would have a choice to go to the medical facility that they think best suits them. This obviously is important, but most importantly, our veterans who have been able, and some have not been able despite legislation, to take advantage of the choice card have universally been in favor of it. Today, they're still facing obstacles to accessing and using the choice card due to the 30-day, 40-mile restrictions that are currently in place. And it's important that we allow every veteran, no matter where they are geographically, to access to the health care of their choice. I refuse, and we refuse, to send our veterans back to the status quo of never-ending wait times for appointments and inflexible care. This bill would repeal the 30-day, 40-mile restrictions and make the program permanent. I might remind people that after the scandal that took place at the Phoenix VA, where 50 veterans died while on a non-existent waiting list, I negotiated with Senator Sanders, who was then chairman of the Veterans Affairs Committee. Part of the compromise was that there would be the 30-day and 40-mile restriction was part of the compromise. We have now proven that the choice card should be universal no matter where our veteran is geographically or timing. The bill would require the VA to allow veterans to visit walk-in clinics without needing an appointment or pre-authorization from the VA. Under the current system, veterans who develop a cold and can't get an appointment first have to visit the emergency room. We've heard from veterans who have waited for 14 hours in the ER without being seen. The Care Veterans Deserve Act will enable veterans to visit walk-in clinics without an appointment, would extend VA clinic and pharmacy hours to nights and weekends. There are many veterans who are working and unable to take a day off from their jobs for an appointment to obtain a prescription from the pharmacy. It will also free up appointments at the VA for veterans in need of care. The bill would allow VA healthcare professionals licensed, registered, or certified in one state to use telemedicine to provide treatment to veterans in other states. We have remote areas of Arizona that telemedicine is by far the most effective way to treat those with illnesses and those veterans. And if there is a professional that is not from Arizona that can provide that kind of advice and counseling and care, that should happen. The system should go, and this is very important, the VA healthcare system should undergo a best practices peer review by the best hospital networks in the nation, such as Cleveland Clinic, Mayo Clinic, or MD Anderson. Those reviews will begin at VA hospitals with the longest wait times or that has the worst health this effort that we've been making, I believe, has shown some progress. But I think facts remain that we have a long way to go. We've learned a lot of lessons since our first VA reform bill passed. Now we need another VA reform bill to take advantage of lessons learned. I think one of the first indications of real progress for all of us will be when veterans feel that they don't have to contact our offices. We still, in my office, are handling as many as 500 veterans cases at one time, and that hasn't decreased. The day that it decreases, I think, will be the day that we will have shown some progress in care for our veterans so that they are not required to come to our offices, which many of them view as a place of last resort. We have a long way to go. We've made some progress. We need to pass this legislation if we are going to provide our veterans with what they have earned. Senator Ernst is here, and maybe she would like to, would you like to speak?
I would love to. Thank you, Senator. And I'd like to thank everyone for being here today. I want to thank Senator McCAIN for his leadership on this piece of legislation, as well as the other members that have stood up for veterans. And our veterans deserve nothing less than quality, timely care. And you know how we love our veterans. They have fought so hard for us. Now it's time for us to fight equally as hard for them. So the Care Veterans Deserve Act takes critical steps towards addressing the unacceptable shortcomings that we see in our administration right now. And it improves the accessibility, the health care, and oversight to ensure that our veterans are receiving the care that they absolutely deserve. In addition, the legislation includes my reforms to improve health care access for disabled or rural veterans. Many of the folks in the state of Iowa simply don't have easy access to care. By expanding telehealth services provided by the VA, including mental health care treatment for veterans from the comfort and privacy of their own homes. So again, I want to thank Senator McCAIN for showing such great leadership on this effort. It is something that is absolutely needed, and for heaven's sakes, let's take care of our veterans. Thank you very much, Senator.
Thank you.
I just want to thank Senator McCAIN for spearheading this effort. Working with him, as he mentioned, we do get a large number of people coming to our offices asking for help in navigating through the system that is the Phoenix VA and the other facilities around the state as well. And this is important because as much as peer reviews and everything else, which is in the bill, and that's great, what matters most is choice and accountability, because when veterans have a choice, that's what drives reform faster than anything at the VA itself. So I'm pleased to be associated with this effort.
Senator Tillis.
Thank you, Senator McCAIN, for your service now and for your service to our country in uniform. And I just want to thank Senator McCAIN for continuing to show his priority on taking care of the folks who have taken care of us. The North Carolina, about 10% of our population in North Carolina are veterans, almost 1 million people. We have some great VA facilities in North Carolina. We've had some that have struggled over time. I think this bill provides us with an opportunity to really take a look at the ones that are working and applaud them, but always be on the lookout for those cases where they're falling short, as we've seen more recently in Phoenix. The peer level review is a great idea. We have great collaboration right now with our VA facility in Durham with Duke University. Systematizing that, I think, will be very important. Having greater transparency into the performance of the different centers is also important. And making the choice, putting the ultimate power into the hands of the veterans so that they can choose the most timely, most effective way to get their health care. So I appreciate Senator McCAIN moving forward with the bill. I look forward, as a member of the Veterans Affairs Committee, working to get this into law, and working with the VA, who's doing a lot of good work, but we need to do much, much more because we're behind and we need to get ahead for the sake of the veterans. Thank you, Senator McCAIN.